Good afternoon. As of today, November the 6th, Baltimore City has 18,816 reported cases, 148 people hospitalized with COVID-19. And we are at 471 deaths. Our nation is continuing to report record high numbers of COVID cases, surpassing what we saw over the summer. And I'm sure we all heard the governor yesterday say that numbers in the state are also trending in the wrong direction. Today, I'm announcing increased restrictions in Baltimore City that will go into effect next week. As of Thursday, November the 12th at 5 p.m., outdoor and indoor gatherings at public and private facilities, private homes, and any public space are limited to no more than 10 persons. Gatherings at event venues and spaces with a fire marshal rated certificate of maximum occupancy are permitted to open up at 25% of the facility's maximum capacity. Religious facilities shall not exceed 25% of the religious facility's maximum capacity. Retail establishments and malls are capped at 25% maximum capacity. Personal service establishments are capped at 25% maximum capacity. Indoor and outdoor recreational establishments are capped at 25% maximum capacity. Fitness centers are capped at 25% maximum capacity. The casino is capped at 25% maximum capacity. Theaters and outdoor entertainment venues are capped at 25% maximum capacity. Food service establishments are capped at 25% maximum capacity. Also, bars licensed as low priority food service facilities, which are not licensed for food service, are not permitted to open. And food service establishments must close indoor dining at 10 p.m. I am instituting these restrictions for the public health and to save lives in Baltimore City. I'm here periodically to ensure our residents have the most up-to-date and accurate information so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resource and support they need at this time, while continuing to leverage the wealth of medical and public health experts right here in Baltimore City. I want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. Again, that's coronavirus.baltimorecity.gov. There, residents can find real-time data for Baltimore City as well as locations for where they can get tested. We are still in a pandemic, one that's built to spread rapidly in groups of people. The coronavirus pandemic hasn't gone anywhere, and we need all residents and visitors to act accordingly. Wear a mask when out in public, watch your distance to others, and wash your hands often. I know there is COVID fatigue, but now more than ever, I need the residents of Baltimore City to remain on guard. We're coming to a time of the year where the risks are going to increase. The weather is getting colder, and people will want to spend more time together indoors. A lot of the cases we are seeing are from indoor and family gatherings. We need to be even more cautious to keep our loved ones and our neighbors from getting sick and dying. If we want to stop the surge in cases before the holidays, we have to be cautious and change behaviors now. I'm continuing to work with Health Commissioner DeVasa. I am continuing to work with our Health Commissioner, Dr. DeVasa, and our public health experts to review data and determine when it is safe to further loosen restrictions or, if needed, tighten them back up. We are continuing to prevent deaths and life-altering illnesses by making decisions based on the data. Again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. And as always, we will continue to monitor the data daily. Also, remember to get your flu shot. Don't take chances with your life or your family. Get your flu shots today. And lastly, before I turn it over to Dr. Zavasa, I want to inform the public that our health commissioner has just updated her mask order effective immediately. Everyone is required to wear a mask, whether in public in Baltimore City, whenever in public in Baltimore City, and again, effective immediately. Now I will ask Baltimore City Health Commissioner Dr. Letitia DeVasa to update you on our COVID response and how we are supporting residents and families in our city.
Good afternoon, and thank you, Mayor Young, for your continued leadership during this health crisis. Over the past month, Baltimore City has seen our data trends move in the wrong direction. A few data points of particular concern as follows. Our latest 7-day average new case rate is 17 cases per 100,000 people, and we have recorded an average of 103 new cases per day, an increase of over 53% over the last month. Our positivity today is 4.5%, and our latest 7-day average positivity is 3.5%, an increase of 41% from 4 weeks ago. Between October 2nd and November 2nd, the number of COVID-19 patients in acute care beds increased by 64%. The number of COVID-19 patients in ICU beds increased by 73% here in Baltimore City hospitals. This data is alarming and requires action. I thank Mayor Young for taking such action. With the new orders in effect, Baltimore City is moving to an amended Phase 1. We believe that if these restrictions are followed by city residents, we can change the direction of these trends. I want to reiterate, these interventions, while important and necessary, are not a replacement for the personal responsibility we all have to maintain social distancing, wear our face mask over our nose and our mouth, wash our hands frequently, and stay home when we aren't feeling well. Baltimore has been here before. In late July, we saw a similar rise in cases, and in early August, we implemented similar limitations on occupancy and gatherings. A few weeks later, we saw a dramatic decrease in new cases throughout late August and early September. The health department will continue to monitor new case data over the coming weeks to see how the interventions put in place will change the trajectory of these cases or if additional interventions are required. Perspective is important. Today, the health department has had its incident command structure operating for 11 months since first learning of the novel coronavirus earlier this year. For months, most residents have heeded our warnings on social distancing, mask wearing, and hand sanitizing. We've all missed birthdays and weddings, cookouts and graduation parties. Grandparents haven't seen grandchildren, and family haven't been able to visit their loved ones in nursing homes and assisted living facilities for months. As we turn towards the winter months, especially with the holiday season right around the corner, it is so tempting to want to relax and give in to pandemic fatigue. I'm sure many want to ignore the public health warnings about family gatherings, wearing masks, and maintaining social distancing. However, Baltimore, none of us can afford to let our guard down. For months, we have warned about the possibility of a second wave, and now we're seeing the signs of it arriving. COVID-19 new cases are on the rise, and what we all do over the next few weeks will dramatically impact what our winter looks like. It's critical that all residents do their part. In addition to the restrictions Mayor Young has put in place, we all have a personal responsibility to do the same personal protective measures that have kept many of us safe during this pandemic. If you are in a public space, inside or outside, you should be wearing a face cloth covering over your nose and your mouth, period. Continue to seek out testing when needed based on guidance, and when you are awaiting results, quarantine away from others until those results are received or you've been cleared to be around others by a medical professional. Continue to keep that physical distance of 6 feet from others not in your household. Continue to wash your hands frequently. Continue to stay home and not go to work or other public places when you're not feeling well. Please try to limit your time in public spaces, especially those with poor ventilation. Also, if you haven't already, as Mayor Young mentioned, please get your flu shot to help you stay healthy and reduce the potential burden on our healthcare system. As for holiday planning, the Baltimore City Health Department strongly urges residents not to plan for large in-person family gatherings. This year, plan to celebrate the holidays with members of your immediate household only. The CDC has indicated that family gatherings are one of the main contributing factors to the recent rises in cases across the country. We believe it's because when we're around our family, we all naturally let our guard down. And many of the harm reduction practices, such as wearing your mask, avoiding close contact, and reducing your time spent indoors, are just not being followed. Is Thanksgiving with all of your extended family worth the risk of putting an older loved one in the hospital? Is your Christmas morning spent together worth a New Year's spent in the hospital? Checking in by phone or video this year for the holidays may very well save a life. Thank you and be safe, Baltimore.
Thank you, Dr. Terrassa, for your leadership on this, and I really appreciate your advice that you have given me. I know this pandemic has been extremely tough on everyone, frontline workers, students, our older adults, our residents experience homelessness, and our businesses. And government's role at times like these is to continue to support those communities and provide resources to lessen the impact. Next, on Monday, November the 9th, the Mayor's Office and Baltimore Development Corporation will announce details on the availability of new grants specifically for restaurants. Approximately $6.5 million in state grants have been made available by the state of Maryland to help offset COVID-related expenses incurred or to be incurred by restaurants. The application period will be from November the 12th through November the 24th. These grants will not be awarded on a first-come, first-served basis. Details, along with specific selection criteria, will be posted on baltimoretogether.com. And I'll say that again, details along with specific selection criteria will be posted at baltimoretogether.com. So please look out for that on Monday, because I know we have a lot of local restaurants that can use the help. I encourage all restaurants that qualify to apply. I want to say thank you and have a safe weekend.